So we will talk about migraine. So migraine also, again, you can start seeing children right from 5 years complaining of migraine headache, and in older adolescents 28%, up to 28% can be the prevalence. Okay, so the prevalence keeps increasing as their ages. The mean age of onset will be, for boys it is actually around 7.2 years. So right from 7 years boys have an earlier onset, girls have typically a late onset of migraine, say around 10.9 years. Before puberty boys have a higher prevalence, and after puberty females have a higher prevalence of migraine, that is 1:3. So migraine, we all know, it is typically a one-sided headache, throbbing headache, and it can last from 4 to 72 hours. So but there are certain alterations when it comes to pediatric age group. In pediatric age group, typically that one-sided headache is not appreciated even in migraine 1, and this duration 4 to 72 hours, this is relaxed a little bit. We have come down on the duration, so starting from 2 to 72 hours. Okay, so it's not 4, even from 2 it is taken as migraine. Okay, so among the pediatric age group, if you have ruled out all the secondary causes, recurrent headache, the most frequent cause of a recurrent headache will be migraine, and migraine is an acute recurrent headache. Okay, it is an acute recurrent headache, and most often it occurs as episodic attacks, and the severity will be moderate to severe in intensity. Patients will tell us it is a throbbing pain, and pediatric patients also, they will point out in the head, telling this is the location where I get the headache, doctor. So they might keep like a hand on place the hand on the scalp and tell here is the pain. So they'll place their entire hand, so they will have a focal location on the head, and typically it will be a throbbing quality headache. And migraine is associated most often with nausea or vomiting and photophobia or phonophobia. So we will see the classification of migraine first. So migraine, again, it is classified as with aura, without aura. Okay, among pediatric, without aura is the more common one, and migraine with brainstem aura, hemiplegic migraine where the patients have a transient focal deficit is also common, retinal migraine or a chronic migraine. So these are all variants of migraine. Complications of migraine is, one is a prolonged migraine, that is status migrainosus. Another one is a migrainous infarction. So there can be a focal infarction secondary to a vessel involvement, that is also one of the complications of migraine. And there can be syndromes, episodic syndromes associated with migraine, like cyclical vomiting syndrome, abdominal migraine, BPV, that is benign paroxysmal vertigo, and benign paroxysmal torticollis. So these are all episodes or syndromes which are associated with migraine. Exactly during an episode of cyclical vomiting or an abdominal migraine, the patient will not have a migrainous headache, but these are all syndromes which are associated with migraine. So say if a child has a cyclical vomiting during his childhood, he or she is predisposed to develop a migraine later on in life. So these are all migraine variants or migraine syndromes which are associated. Okay, so we will talk about cyclical vomiting, BPV, etc., and we are going to discuss the same in another presentation also. The name of the presentation is seizure mimics. So that also we will be discussing about this. So for now, just remember, migraine classification is also given under our ICHT, International Classification of Headache, this thing, third edition under B. So migraine without aura is the one which is common in pediatric age group. So how are you going to give a diagnosis of migraine without aura? So here you can see there are 5 points, A, B, C, D and E. So for diagnosis of migraine without aura, the patient should have at least 5 attacks. Okay, at least 5 attacks, and it should fulfill criteria from B, C and D. E is nothing but excluding other secondary headache, that is E. Okay, so we will see what is B, C and D. B is, first is duration. So the duration should be between 4 to 72 hours. In children you can relax it a little bit, keep at least 2 hours. Okay, and next is about the quality of the headache. So at least 2 of these 4 criteria should be present. So number 1, unilateral location. Number 2, pulsating quality or a throbbing quality. Number 3 is a moderate or a severe intensity headache. And number 4, aggravating factors. So if the patient does any physical activity, it will increase. Okay. So these, among these 4 criteria, even if 2 is present, you tick the C criteria. Okay. So it is about the quality. Third, in the D, coming to the D criteria, there are 2 factors which are present. Okay. One is either nausea or vomiting. So either of the 2 should be present, or photophobia and phonophobia should be present. So either of these 2, one criteria, even if it is present, then it qualifies the option D also. So migraine without aura, again there should be 5 episodes and 5 attacks also should fulfill the criteria from B, C and D. B is about the duration, 4 to 72 hours, or it can be relaxed a little bit, kept at 2 to 72 hours also. C is about the quality of the headache. So in that quality of headache we have 4 factors. Number 1 is unilateral location. Number 2 is pulsating or throbbing quality. Number 3 is moderate to severe intensity. Number 4 is aggravated by any physical activity. D criteria is association. So nausea or vomiting should be present, or photophobia and phonophobia should be present. So this definitely will be there when you suspect a patient with migraine, and if you can do this criteria, you will definitely find that most of the children will fit in this criteria and you can make a diagnosis very easily.